Have you ever wondered how a nurse checks someone's blood pressure? Or even more important, have you ever wondered what those numbers means when she advises you of them? Blood pressure is determined by the amount of blood pressure your heart pumps, and it is the force of blood that is being pushed through your artery walls. Uncontrolled blood pressure can be very dangerous. Sometimes high blood pressure has no symptoms, and you may not be aware that it is damaging your arteries, heart, and other organs. High blood pressure can lead to stroke, heart attack, blindness, and kidney failure. I am a medical assistant at a family practice. I've been a medical assistant for about 5 years. I'm going to show you how to do blood pressure the correct way. Many errors can occur in a medical facility that can determine a patient's health status. First, you have to make sure that the patient is comfortable and they are sitting with their back against the chair and their feet flat on the floor. Make sure their legs are not crossed. And when you do check their blood pressure, that their arm is above the heart level. There are different size cuffs. We have 3 in our office. Well, there's other sizes, but the 3 main ones are large, medium, and small. Size is very important. Too small can increase the blood pressure numbers because it would be overly compressed on the artery. If it's too large, it may decrease the blood pressure numbers because it's not compressed enough. We're going to go ahead and place the cuff on Gloria. You have to make sure it's on the bare arm and at least 1 inch above the elbow. This cuff is helpful because it kind of tells you where her brachial artery is. The brachial artery runs down this brachial arm. You're gonna have to locate it as well. So you've got to feel for it, and it feels like a pulse in that area. And that's where you're going to place your stethoscope when you do check it. And when you do check it, make sure there's no talking, or else it's kind of hard to hear. Okay, so the first sound that you're gonna listen for 2 sounds, or you're gonna listen for a sound. That first sound is called there's 2 numbers that you're gonna get. If you've ever heard anybody tell you blood pressure 120 over 80 or 110 over 60 and so on. The systole is the first sound you hear, and the diastole is the sound when it stops. You're going to record that. So I'm going to take my stethoscope and I'm going to place it over her brachial artery. You're going to inflate it to about 180, slowly deflate, and then listen very closely. So you hold the stethoscope with one hand, and then the other one you're going to twist and inflate the cuff. Do not use your thumb, because sometimes you can hear your own pulse through your thumb. Inflate to 180. Okay, and then deflate. Gloria's blood pressure was 132 over 80.
Yay.
Systole is the degree of force when the heart is pumping. Diastole is the degree of force when the heart is relaxed. Normal systole is 120, and anything over 140 would be hypertension. Normal diastole is 80, anything over 90 would be hypertension. Hypotension is low blood pressure. Anything under 90 over 60 is low blood pressure. Blood pressure is one of the 5 assessments that is performed in a medical facility. The assessments are called the vital signs. Vital meaning that is very important to a patient's health. According to the CDC, the Centers of Disease Control, hypertension is a modifiable risk factor for cardiovascular disease. It affects 1 in 3 adults in the United States and contributes to 1 out of 7 deaths, and nearly half of them cardiovascular disease-related deaths in the United States.